Hey everyone, Dr. Bupp here at Advanced Health Wellness Center, and we have a really cool story to share with you. This is our wonderful patient Donna, and so she had some really great news today, and we wanted to share with you guys things that are possible that maybe we didn't really believe or know or understand were possible. So, Donna, I got some questions for you.
Sure.
So first of all, what brought you here in the first place?
Well, the first one, Jess has been hounding me, my daughter, who's been coming here for 2 years.
Right.
And you've got her completely off of her rheumatoid medication.
Right.
And healthy way of starting, so she's been hounding me. So I came in because my life was going down the toilets.
Okay.
I was on all kinds of medications and still feeling the effects of rheumatoid arthritis.
Right. So taking medications but not feeling well.
Exactly.
Okay. So you saw your daughter, which she had an awesome, we might have done her video too. She had an awesome story too. So she was at one point rheumatoid positive, and then another point not rheumatoid positive, RA
Right.
positive. And so that was a pretty cool change. ANA positive, then not ANA positive.
Yep.
Then ANA negative.
Mm-hmm.
Antibodies, thyroid antibodies went down, so that was cool. So you were like, oh, I don't want to be shown up by my daughter.
Something like that, yes.
Right? Okay, so
she's very persistent.
Right. What medications then were you taking?
I was on Enbrel injection once a week, Celebrex.
Immunosuppressant,
Yep.
right?
Celebrex, max 200 milligrams a day.
Yeah, so just, as we think about those things, so immunosuppressants leave us vulnerable for a lot of things because it's stopping our immune system from doing what it would like to be doing. Celebrex, as we know, there's lots of side effects potentially attached to that one too, warnings, from things, bleeding and aneurysm type issues. And then, so what else?
Methotrexate.
Yep.
And folic acid.
Yep.
And Prevacid for acid reflux due to the anti-inflammatory medicine I was on prior to the Celebrex.
Yeah, so that created some problems with the stomach.
Yes.
All right, so great history.
Yeah, great.
Okay, so, and blood pressure medicine?
Blood pressure medicine as well, yes, I forgot about that, lisinopril.
Yeah.
Mm-hmm.
So, not going in the right direction. So we go, well, is this person healthy or are they not healthy?
Nah.
Right, when you see all those medications and the person's still having problems, you go, this isn't good.
Right.
So then, so what happened today?
Today I went to my rheumatologist. I told him how well I've been doing about my Candida diet with Amber here.
And how much weight have you lost?
25 pounds in 54 days.
Which is awesome,
Yes,
right? Less
very
than
much
2
so.
months.
Yes, less than 2 months.
Cool.
And I have talked to the doctor. He took me off of my Prevacid because I've had absolutely no acid reflux.
Nice.
I'm off Celebrex only as needed. He has reduced my lisinopril, or reduced my methotrexate. And then today, following up with blood pressure medicine here, my blood pressure is no longer needed. My blood pressure is 108/74. Yes.
And how did you feel about that?
I've been on cloud 9 all day.
So I
couldn't wait to get here and tell you guys.
Yes. So tell us that part. Tell the camera that part.
I felt like 2 months ago I was going down a very dark path where my husband and I wanting to retire in 5 years was not going to be much of a retirement life, which is what we had worked very hard for. And literally within the first 2 weeks of the program here, I felt relief on all of my joints. I feel like I've got my life back. Thank you very much.
How cool is that?
Thank you. Awesome, cool.
But here's the other thing. You've been dedicated to it. You've showed up all
Twice
the time. You haven't missed any appointments. You've been, pushing away summer food, picnic food, camping
and
food.
camping, still doing this and still enjoying my life.
Right. Because why? Because the goal that you had set was more important than the other things. right? And if we can learn from that, it is possible.
Very much so.
And is there a better feeling than thinking that you got your life back?
No.
Right.
It's awesome.
Yes.
It is very awesome.
Cool. So, guys, if you have questions, comments, whatever, Donna is happy to answer your questions. We're happy to answer your questions. Please share this with someone who's lost hope in their health and needs to get it back. We'd be happy to hear from you. Have a great day.